So the difference between acute otitis media and otitis media with an effusion is that acute otitis media usually is painful, usually there is fever, usually the child is irritable. It can affect hearing and it might be painful, but it should not have fever. And the way that we tell the difference is really on physical exam. So when you're looking at the ear, if there are signs of infection like redness or erythema injection, if the eardrum is bulging, those are more indicative of an acute otitis media. Otitis media with effusion means there's no signs of infection, so it's not red, but there is an effusion behind the eardrum. And it's important to make the difference here in distinction on physical exam because otitis media with effusion is not an infection and therefore does not respond to antibiotics. But often we are treating it with antibiotics because the bulging ear can look a lot like an acute otitis media, except it lacks those infectious signs. So if you have otitis media with effusion, the treatment is really just watchful waiting. We watch these, they do take a long time to go away, sometimes 3+ months. So for the first 3 months, we're doing all watchful waiting as long as there's no other risk factors. As long as that child doesn't have risk factors for speech or hearing delay, as long as the hearing is not affected, we're just going to watch and check again every couple of months to make sure that that effusion has resolved. If the hearing is affected or there's risk factors for speech or hearing delay, we usually send those patients over to ENT for possible ear tubes. There's no proof that other adjunct therapies like antibiotics, systemic steroids, topical steroids, antihistamines affect the ability of that middle ear effusion to go away faster or to be symptomatically improved. So really there's no role for those additional therapies. If the hearing is affected, again, we usually refer them to ENT. Sometimes the ENT docs will put in ear tubes. If they've had to put in multiple rounds of ear tubes, sometimes they will talk about the role for an appendectomy, but really the vast majority of these children should just be what we call watchful waiting.